So let me start with Michael Irwin. Michael Irwin, UCLA medical doctor. He's a distinguished professor in the Department of Psychiatry and Biobehavioral Science. He's a director of Center for Psychoneuroimmunology. He's the director of the Mindful Awareness Research Center. He's elected president for the Academy of Behavioral Medicine Research. He is distinguished professor because of his lifetime contribution to understanding the reciprocal interactions between central nervous system and the immune system for health. He has had more than 30 R01 type research projects that he led. He's also has been elected as a president for the Psychoneuroimmunology Society and for the American Psychosomatic Society. Over 450 articles, so full respect, Michael.
Thank you very much, Wolf. I appreciate it. And thank you also for the organizers for inviting, for one, organizing this incredible meeting. It's been really a delight to be here and participate and watch and hear all the presentations, but also for inviting me to provide a lecture to you. So today what I'm going to do is be talking about how Tai Chi regulates the immune system. And I'm going to be focusing on really two components of the immune system, the viral specific immunity and also inflammatory immune system. First, I'm going to just provide you with a brief summary of the literature related to Tai Chi and the immune system. Characterizability of Tai Chi Cha, and mainly most of my studies have to do with Tai Chi Cha, to increase viral specific immune function and augment a vaccine response. And then I'm going to move to evaluate the specificity and magnitude and durability effects of Tai Chi and Tai Chi Cha on reversing inflammation, including measures of systemic inflammation, cellular inflammation, and also genomic markers. I don't need to tell you at the end of, now 4 years of a pandemic, that the immune system is really critical for our overall health. And infectious disease, in fact, poses one of the greatest public health challenges facing humanity. COVID-19, nearly 800 million confirmed cases, greater than 7 million cases of deaths since 2019. Influenza is another virus that we live with every year, every season. Over 1 billion infections, 5 million severe cases, and over 500,000 deaths each year, even though we have effective vaccines. And HIV, also over 40 million deaths since inception. So infectious disease is an incredibly important public health challenge, continues as viruses cleverly outwit our immune system and our vaccines. Chronic inflammation, another kind of aspect of the immune system, also contributes to significant morbidity and mortality. And it's estimated that inflammation is the primary culprit of the biological mechanism contributing to over 50% of global deaths through its contribution to increase risk and also progression of cardiovascular disease, cancer, diabetes mellitus, and also neurodegenerative conditions. So there are two major components of the immune system, as I've talked about. There's the innate immune system, and there's the adaptive immune system. The innate immune system is our first line of defense. I talk about inflammation as being pathologic, but we also know that inflammation is really critical to trigger the immune response so we can actually mount an adaptive immune response. So an acute inflammatory response is beneficial, but with chronic stresses, sleep problems, depression, chronic diseases, you can have chronic low-grade systemic inflammation, which is what I'm going to be mainly addressing in my talk today. Adaptive immunity plays, as I mentioned, a critical role in containing the immune infection. I'm going to be talking about one particular aspect of the adaptive immune system, and that is the memory T cell response. So once we're exposed to a virus, our T cells learn and have then the memory to recognize that virus again. And that memory T cell response remains in our circulation, providing a very early response if we see that virus again. And so the frequency, the number of those immune cells, those memory T cells, and also their ability to respond is really critical. I'm going to be showing you some of those responses today. This is a slide that I pulled from one of our articles in Nature Reviews Immunology, talking about how stress mechanisms, the very processes that we know regulate the stress response, also have a very important effector role in regulating the immune system. I'm not going to spend a lot of time on that, but there's two major components. One is the sympathetic nervous system. The second is the HPA axis. And they act in similar ways to regulate the adaptive immune response, in that both the sympathetic nervous system and the HPA axis act to downregulate the adaptive immune response. But interestingly, the sympathetic nervous system acts in a differential effect upon the adaptive and the innate immune responses. The sympathetic nervous system acts on the adaptive immune response to also produce a decrease. However, the sympathetic nervous system acts on the innate immune response, much like it should, because it wants to trigger that inflammatory response to be able to respond to acute threats to actually increase that innate immune response. So that's something to keep in mind. But one of the things that I want to address is that most all mind-body interventions, and Tai Chi being one of the most salient, they have some of the most robust data, produces a decrease in this sympathetic outflow and also alters the HPA axis as well. This is a meta-analysis. I want to review now some of the literature that's been done in this area, particularly on the immune system. And this is a meta-analysis that Dr. Chechen Wang and I published several years ago, looking at different aspects of the immune system and looking at particularly pro-inflammatory cytokine responses in this particular slide. Pro-inflammatory cytokine responses are a part of the innate immune system. And you can see that there is an overall ability for these mind-body interventions, whether it be yoga, Tai Chi, meditation, that each of these responses produces a small but significant effect in a favorable way, to reverse or lower that inflammatory response. A more recent meta-analysis was conducted by another one of our panel speakers today. That's Dr. O, who did a much more comprehensive, more recent evaluation, finding a very similar effect across multiple different aspects of the immune system. And those effect sizes are fairly significant. I can't remember what the difference is because I can't see it from here. Dr. O can maybe tell us. So the other thing is that also you see a significant and much more heterogeneous response in terms of the inflammatory responses to Tai Chi and Qigong. So let me introduce you to some of the work that's been done in this area. And before this talk, I really searched the field to evaluate whether this study, which we published probably over 10 years, maybe 15 years ago, has been replicated, or whether it's been extended to another population, or whether it's been extended to another viral specific immune response. And I failed to find any recent studies on this topic. So this study stands as it is. We have replicated it internally, at least one aspect of it, so I'll show you that in just a moment. That was the ability for Tai Chi Cha to increase viral specific immunity and also response to vaccination. We chose to look at a viral specific immune response and chose to look at herpes zoster, which is regulated by or driven by the varicella zoster virus. Varicella zoster is a chickenpox virus, and all of us that live in the United States, I do say all of us, have been exposed to the chickenpox virus. We may not have known it, but we have been exposed either by vaccination or by actual clinical exposure. That virus is very clever. It remains hidden in our nervous ganglia throughout our adult life. And then at periods of time, as shown by this fluctuating column, that our immune system begins to decline as we age. And then the virus can escape our immune system control of it and then express it with this very severe rash, which is a rash, but the rash produces excruciating pain and significant morbidity for these individuals that are older. And so we did a study with Michael Oxman, led this study that actually led eventually to the varicella zoster vaccine, showing that varicella zoster vaccine, or Zostavax, could actually decrease the likelihood of the infection and also the post-traumatic neuralgia. But you can still see that there's a significant percentage of older adults that continue to have that risk. And so what we want to do in this study was couple the presentation of the vaccine with Tai Chi and see whether the Tai Chi could actually boost immune response by itself, which we've now had replicated in this study, and further, whether the vaccine plus Tai Chi would produce an augmented response. And as shown in this particular slide, we have evidence of both. That across the intervention, the administration of Tai Chi Cha significantly increases the level of this memory T cell response, actually comparable to the level achieved in the placebo group that did not get Tai Chi that were then exposed to the vaccine. Furthermore, when the people were exposed to the vaccine and had practiced Tai Chi, their immune system continued to increase, and the dotted line is that of the memory T cell response of people that are 30 years their junior. Next area of my talk, in the next 4 minutes, will be Tai Chi and Tai Chi Cha and the mitigation of chronic inflammation. I'm going to go through this fairly quickly. So the first study, we looked at older adults, and we evaluated not just simply whether we could reduce inflammation, but whether the people that had higher levels of inflammation were more likely to show that decrease. And one of the things that was very striking in this data is that Tai Chi Cha did not actually increase inflammation. It is an exercise, so it might have increased the inflammation, and we didn't find that in people that had low levels. But the people that had high levels of circulating IL-6 showed a decrease over time in the levels of IL-6, this pro-inflammatory systemic marker of inflammation, as compared to an active comparator condition. Now, Helen Lavretsky talked about the health education comparator. This is a very active public health tool to improve quality of life, to provide people information about how to improve their health behaviors. So this is a very active tool, and yet, even despite that use of that active placebo group or control condition, we found that Tai Chi Cha produced a greater decrease in systemic inflammation as compared to health education. We went on to replicate that finding, looking at 2 other markers, that is the cellular markers of inflammation, looking at the ability for monocytes, which are the primary cells in the immune system that produce the pro-inflammatory cytokines, upon stimulation to a pathogen. And we mimic that stimulation to a pathogen by giving them a substance that signals a receptor on their cell surface that leads to the production of those pro-inflammatory cytokines. And we evaluated to what degree that response would be downregulated or normalized in people that practice Tai Chi as compared to another active condition, and that was cognitive behavioral therapy for insomnia. Both of these treatments, we had found preliminarily, could produce an improvement in sleep problems. 90 breast cancer survivors randomized to 2 arms, Tai Chi Cha, CBT-I, and then delivered for 3 months, and then followed for 1 year. And what we find is that Tai Chi Cha produces a differential improvement in the downregulation of the cellular responses to this inflammatory challenge as compared to CBT. but that both Tai Chi Cha and CBT can produce some alterations in the genomic levels. But once again, Tai Chi Cha produces a greater downregulation in the inflammatory responses at the genomic level. So both at the cellular, systemic, cellular, and genomic levels, we find that Tai Chi Cha has a differential improvements. Please don't take a photocopy of this particular slide. These data have not been published. We've now followed these breast cancer survivors for 1 year and actually found that that decrease that we found acutely is maintained over that 1 year period of time with, once again, a differential and greater response in the people that practiced Tai Chi Cha as compared to the CBTI group. And I emphasize that the responses to this is a non-inferiority trial, and CBTI and Tai Chi Cha was non-inferior. That has both produced a significant decrease or remission of the insomnia, but we found a differential improvement in the practice of the decrease in inflammation with those that practice Tai Chi. And furthermore, when we look at the genomic responses, we find this dramatic decrease in the responses in what we call the CTRA, but also which is a decrease in the inflammatory responses. And those decreases in the inflammatory responses are maintained in the Tai Chi group, but not in the CBTI group. Further, both groups show a differential increase in antiviral immune responses. And I'm basically running out of time. A further replication of this finding in older adults with insomnia. So we had breast cancer survivors, now older adults with insomnia, 123 people followed for 1 year, and similar findings of a normalization of systemic markers measured by CRP, and also this cellular immune response measured by the production of monocyte production of pro-inflammatory cytokines. But both CBTI and Tai Chi, as compared to an active comparator condition, produced a decrease in this inflammatory response. So I don't want you to have the understanding that Tai Chi Cha is the only thing that can produce improvements. It's just better than CBTI. But both CBTI and Tai Chi, compared to a control condition, can produce a decrease in this genomic inflammatory response. I don't have time to go into this. These effects were more likely maintained in the long term in the individuals that practice Tai Chi. I think I'm just going to have you read that for a minute here. One of the things that we need to do is actually evaluate whether this response that we find in the memory T cell response generalizes to other viral infections. The memory T cell responses occurs across multiple viral infections. We also need to evaluate whether if Tai Chi boosts the vaccine response, it is not known whether it generalizes to other vulnerable populations and also produces a durability or an increase in the long-term protection of vaccines. And we all know that with COVID, we have to repeatedly get the COVID vaccine. And might it be wonderful if a mind-body intervention, particularly Tai Chi, based upon these data, produce a more durable response. And then finally, we really need to have studies that evaluate whether these changes in the inflammatory markers have consequences for clinical outcomes, cardiovascular outcomes, diabetes outcomes, and so on. And I'm going to conclude at that. Thank you very much for your attention.